this is Rochelle at the Athlete Center. This is going over some self-ankle mobilizations. So we've got sort of multiple joints at our ankle, and sometimes if our ankle's stiff, a little bit of extra help with moving in those joints can help increase range of motion and decrease pain. So everybody's going to be a little bit different. This will be a bit of a trial and error. I do not suggest doing this if you are in acute inflammation. So if you have bruising and swelling that's fresh, don't try this unless you've been instructed otherwise. So what we're going to do is we're going to stabilize our lower leg. So these kind of like pointy bones, this is our medial malleolus. We're going to stabilize our medial malleolus, and the pointy bone on the outside, that's our lateral malleolus. So we're going to stabilize those, and we're going to work on moving the bones underneath those. So you can, and if we're working on being able to point our foot, then you're going to move that ankle bone and point. If you're working on being able to go toes to shin, then you're going to move your ankle bone and go toes to shin. So you can either do a downward pressure, so that's a lateral glide going from the inside of your foot to the outside of your foot, and move through that range. For me, that doesn't feel great. If I do an upward pressure, so that's a medial glide going from the outside to the inside, an upward pressure, that feels much better. Again, everyone's different, so play around with this. So I'm stabilizing here, this isn't moving, and then I'm drawing this ankle bone upwards as I move through the range. We can also go forward and backwards, so that's medial and lateral. We can go anterior and posterior, so I can push this ankle bone forward again, stabilizing here, because if I don't do that, my whole leg's gonna move. Stabilizing here, pushing forward and going through this motion, or pushing forward and going through, like that one to me doesn't feel great. This, if I push forward and go point, that feels much better. So that's the way I would do it. And then we can go the opposite. So pulling this bone backwards and pointing, or pulling this bone backwards and going toes to shin. So play around with that. Sort of the key is that we're stabilizing here and moving here as we do a different movement depending on what your goals are. If you have any questions, leave them in the comments.